Hello everyone. Thank you for tuning in to this podcast series on tobacco control. I'm Mwaka Nyimbili, Center for Trade Policy and Development Communication Specialist. On the show today, we are looking at the effects of tobacco smoking on young people. According to the Ministry of Health of Zambia, over 7,000 tobacco-related deaths are recorded annually, with youths and adolescents being the most at risk. The most recent global adult tobacco survey also reveals that consumption of tobacco is increasing among adolescents and youths in Zambia. Among the reasons cited for this include accessibility and affordability of tobacco products on the Zambian market. To discuss this conversation on this podcast, I have a special guest, and his name is Dr. Blessings Kasenge. Welcome to the show. Briefly tell us a bit about yourself and what you do.
My name is Blessings Kasenge, and I'm an ambitious medical doctor by profession. I'm also the programs coordinator for the Young Professionals Network, which is a network of young people who are doing amazing things to put the name of young people on the global map. Apart from that, I'm also working with various youth-led organizations, both locally and internationally, in enhancing youth participation in various areas such as governance, such as health, to mention but a few. My passions lie in leadership, public speaking, as well as helping young people achieve their own potential, because what I believe is that we can only achieve our own potential when we help others discover theirs.
To get into this conversation, how accessible are tobacco products on the Zambian market?
So when we talk about accessibility of tobacco products on the Zambian market, one thing that we must all understand, and one thing that is for a fact, is that tobacco products are very accessible here in Zambia. And they're very accessible due to two main reasons that I will highlight. The first reason is affordability and cost. It's very cheap to actually acquire or purchase a tobacco product, for example, a cigarette or shisha here in Zambia. And so what this has meant is that anyone, regardless of their socioeconomic status or background, can be able to access these tobacco products. And the second reason is we lack clear rules and regulations and clear laws that bar people from purchasing these tobacco products. That's why we find that there are certain instances where parents even send their children to go and purchase these tobacco products. You can walk into any bar today, walk into any shop, and you'll be able to access these tobacco products. So when we talk about accessibility on the Zambian market, I think it's fairly can be concluded that these tobacco products are very accessible. And research has actually shown that the cost of purchasing a cigarette or any other tobacco product on the Zambian market is among the least in the region as well as on the continent. And this just speaks and supports to the fact that these are very accessible and they are very affordable.
From your experience as a medical doctor, what has been the impact of tobacco smoking on young people and as well as the country's health sector?
So when we talk about the effects of tobacco on young people, one thing that we should understand is that every year nearly 8 million people die due to tobacco smoking. And of these tobacco smokers, we have those that die from active use and those that die from passive use. So when it comes to tobacco itself, we can safely conclude that everyone is at a risk of dying from tobacco, either as an active user or as a passive user. And that's why it's important that this conversation should be a conversation that all of us should be having. So when we discuss the effects, it's important that we understand firstly what are some of the components of these tobacco products themselves. And so these tobacco products have what we call carcinogenic elements. And by carcinogenic, we mean that these elements have the propensity or the potential to cause cancer. And that's why you find that tobacco smoking is a risk factor for most of the cancers. You can talk about breast cancer, prostate cancer, lung cancer. It's because these are carcinogenic elements. And among the products that we can talk about that are of major concern for us are nicotine, tar, and carbon monoxide. So nicotine really depresses cerebral function, and nicotine itself is addictive. And so what we see is that most young people who start abusing these tobacco products become glued and become addicted to these tobacco products because of this nicotinic component of the tobacco products themselves. Then the second product that we can talk about is tar. So tar itself is carcinogenic, and once inhaled, it settles in the lungs. And when it settles in the lungs, it causes an inflammation. Now, we all know that the functions of the lungs are mainly for respiration, and respiration involves gaseous exchange between oxygen and carbon dioxide. So once we inhale this oxygen, we exchange it for carbon dioxide. And so what happens is that when this exchange is impaired, mainly due to this tar, it means that someone is going to have an accumulation of carbon dioxide in their bodies, and they will not be taking in much oxygen, and they will not be able to send this oxygen to various tissues of the body. And so what happens is that someone may eventually develop a respiratory failure, or someone may develop a pulmonary disease in this case, and eventually someone may develop a lung cancer. So we see that the effects of the tobacco smoking on the respiratory system are quite detrimental, and not only the respiratory system, but these tobacco products also have an effect on the cardiovascular system. So what happens is that these tobacco products may cause infarcts, and these infarcts may cause blockage of the arteries that supply the heart, and so the heart will be deprived of blood, and therefore the heart will be deprived of oxygen, and someone may develop what we call a myocardial infarction, which may eventually lead to a biventricular or a congestive heart failure. And so we see that once the heart has failed, every other organ of the body begins to fail. The liver in this case begins to fail, as well as the kidneys. So we see that the effects of the tobacco products themselves on the health are quite holistic and affect virtually every system in the body. And that's why when we discuss the impact or the effects of these tobacco products, we must really understand that the effects are quite detrimental. So what we have seen with the tobacco products is we have seen an increase in the prevalence of non-communicable diseases, for example hypertension, and that's why it's important that we should spread this message across. Apart from the health itself, the tobacco products themselves have a huge impact on the economy, because what happens is that these non-communicable diseases are chronic conditions, and they have to be treated over a long period of time. And so what this means is that the government has to invest and spend so much money in treating these infections, and these are monies that could have otherwise been channeled to other productive sectors of the economy, for example agriculture and mining, that would eventually grow our GDP and eventually lower the cost of living and reduce the poverty levels in our country. But the government has to spend this money in curative treatment, in treating these chronic conditions that could have otherwise been prevented. And these tobacco products have a huge effect as well on the economy, because young people are the most productive human resource in our country. We are talking about a median age of 18. So it means that the majority of our population is made up of young people. And if these young people are now going to stay glued to these tobacco products, if these young people are going to stay addicted to these tobacco products, it means these young people can no longer be productive, and they can no longer add to the growth and development of our economy.
Being a young person yourself, why do you think it's important for young people to get involved in this conversation?
So young people should be involved in this conversation because young people form the majority of our population. Young people are vibrant, they're creative, and they're innovative, and therefore leaving them in such an important conversation is actually heading for failure. And so young people themselves must also begin to involve themselves, because according to the projections of the World Health Organization, by 2025 here in Zambia, we're going to have 300,000 new tobacco smokers if we do not act. So this is in contrast with other parts of the world where they're actually seeing a reduction in the tobacco prevalence, but we're seeing an increase in Zambia because we're not doing enough to regulate the use of these tobacco products on the Zambian market, and we are not doing enough to involve young people in this fight. Young people can play various roles in helping us regulate or helping us reduce the prevalence of the use of these tobacco products. Young people can participate in advocacy. So we are talking about the tobacco control bill, and if this tobacco control bill is to be a success, then young people must be fully involved. Young people must be at the forefront of advocating that this bill is actually passed by parliament. Young people can also play a role in research. Young people could research on some of the health effects of these tobacco products, and young people could play a major role in raising awareness on these tobacco products themselves. As I said, this is a fight that is going to involve the majority of the population, and this is a fight that we cannot afford to leave young people behind.
And lastly, what's your advice to young people who are struggling with tobacco smoking addiction?
So my advice firstly to young people would be that young people should stay away from these tobacco products. These tobacco products are highly addictive, and once you start, you may not be in a position to stop using these products on your own. So in my language, we say imitikula empanga, simply to mean that as young people, we are the future, and we are the ones that are going to change the fortunes of our country. We are the ones that are going to change the fortunes of our economy, and we are the ones that are going to carry this country on our shoulders. And therefore, as young people, we cannot afford to fail. And therefore, my advice also to the people that are already addicted, or the people that are still glued on these tobacco products, is that an addiction is something that you cannot fight on your own, and therefore you need help, And that's why it's important that once you realize and notice that you're not able to stop abusing these tobacco products themselves, you actually walk to your nearest facility, or you simply talk to someone and seek help. It is very important that as young people, we really help in the regulation of these tobacco products on the Zambian market. We should actually be the ones to raise this awareness. We should actually be the ones to advocate that we regulate, to advocate that we reduce the prevalence of these tobacco products. And therefore, we cannot be the ones to be abusing these tobacco products themselves. And young people, we have a role to also help other young people in various parts of our country who do not understand what are some of the effects of these tobacco products themselves. So therefore, as young people, we realize that we have the biggest role to play, and therefore we need to unite and hold hands together and see how we can carry on this conversation and how we can ensure that this conversation is a conversation that does not end now, but it is a conversation that continues until we actually see something being done by the government, something being done by ourselves, and something being done by other stakeholders.
As we come to the end of the podcast, what are your last thoughts?
So thank you very much for according me the opportunity to be able to add a voice to this important conversation. So this is a conversation that we should be having now, because what affects one person affects us all eventually, and therefore all of us must hold hands and act together.
Well, listeners, there you have it. We've come to the end of this podcast. Look out for another exciting topic next time as we look into issues related to tobacco control.